Namaste. I, Dr. Eva Gupta from JAYOTI VIDYAPEETH Women's University, Jaipur, Associate Professor in Department of KRIYA SHARIR, Faculty of Ayurveda session. Today's session is about regulation of respiration. So, respiration is regulated by two mechanisms. One is neural mechanism and another is chemical mechanism. Neural mechanism regulates respiration by reflex process by help of respiratory centers, afferent nerves, and efferent nerves. Respiratory centers are two types: medullary centers and pontine centers. Medullary centers present in medulla oblongata. There are two groups of medullary center. One is dorsal group and another is ventral group. Pontine center, which are located in bones, and there are two types of pontine centers: pneumotaxic and apneutic center. So first is dorsal group. It is responsible for basic rhythm of respiration. Ventral group, it becomes active during post breathing and stimulate both inspiratory and expiratory muscles. Then pneumotaxic center, it inhibits dorsal respiratory group via inhibition of apneutic center, which results in stoppage of inspiration and starts expiration. It increases respiratory rate by reducing the duration of inspiration. Apneutic center, it increases the depth and duration of inspiration by acting directly on dorsal respiratory group. तो इसका मतलब ये है कि जो डोर्सल ग्रुप है वो नॉर्मल रेस्पिरेशन में हेल्प करता है एंड वेंट्रल ग्रुप है ये पोस्ट ब्रीदिंग में हेल्प करता है, इंस्पायरेटरी और एक्सपायरेटरी मसल्स दोनों को स्टिमुलेट करता है एंड एप्निस्टिक सेंटर डोर्सल ग्रुप को स्टिमुलेट करता है एंड न्यूमोटैक्सिक सेंटर एप्निस्टिक सेंटर को इनहिबिट करके डोर्सल ग्रुप को इनहिबिट करता है. तो जब डोर्सल ग्रुप इनहिबिट होगा तो इंस्पायरेशन रुकेगा और एक्सपायरेशन स्टार्ट होगा. इससे वेंटिलेशन बढ़ता है या रेस्पिरेटरी रेट बढ़ती है. Then afferent nerves. Respiratory center receives afferent impulses from different part of body via branches of glossopharyngeal and vagus nerve and modulate the movements of thoracic cage and lungs accordingly through efferent nerve fibers. Efferent nerve fibers from respiratory centers terminate on motor neurons of spinal cord. From spinal cord, efferent nerve fibers arise in which phrenic nerve fibers supply diaphragm and intercostal nerve fibers supply the external intercostal muscles. Chemical mechanism. It is operated through chemoreceptors. Chemoreceptors are sensory nerve endings which are stimulated by changes in the chemical constituents of the blood, like that means chemical stimulations जो मिलते हैं वो किससे मिल सकते हैं, like hypoxia means deficiency of oxygen, hypercapnia means increase of CO2 in blood and increased H+ concentration in blood. तो या तो ऑक्सीजन की कमी हो या CO2 इंक्रीज हो जाए या H+ आयन इंक्रीज हो. जब CO2 इंक्रीज होती है तो जो CO2 है वो H+ आयन भी रिलीज करती है, क्योंकि जो CO2 है वो RBCs में प्रेजेंट H2O से मींस वाटर से रिएक्ट करके कार्बोनिक एसिड बनाती है एंड कार्बोनिक एसिड इट इज वेरी अनस्टेबल कंपाउंड एंड इट डिवाइड्स इनटू H+ आयन एंड बाइकार्बोनेट आयन. Then type of chemoreceptor. There are two types of chemoreceptor. One is central and another is peripheral. Central chemoreceptors situated in brain in medulla oblongata and peripheral receptors present in carotid body and aortic body. Carotid body is present at the bifurcation of carotid artery and aortic body is present along aortic arc. Central chemoreceptors. When partial pressure of CO2 increases in blood, CO2 diffuses in CSF, means cerebrospinal fluid, and there it combines with water to form carbonic acid which releases, because carbonic acid is a highly unstable compound, it dissociates in H plus ion and bicarbonate ion. So H plus ion stimulates chemoreceptors, resulting in stimulation of dorsal respiratory group, and it induces ventilation. Then peripheral chemoreceptors. When partial pressure of oxygen decreases in blood, it stimulates peripheral chemoreceptors. Peripheral chemoreceptor sends efferent impulses via herring nerve and aortic nerve. Herring nerve is a branch of glossopharyngeal nerve, and aortic nerve is a branch of vagus nerve. It stimulates dorsal respiratory group, and dorsal respiratory group sends efferent impulses to respiratory muscles, and ventilation increases. Then next is artificial respiration. Artificial respiration is the act of assisting or stimulating respiration, a metabolic process referring to the overall exchange of gases in the body by pulmonary ventilation, external respiration, and internal respiration. Conditions when artificial respiration is required, like accidents, drowning means dubna, gas poisoning, electric shock, and anesthesia. It is required when there is arrest of breathing without cardiac failure. And it is done by two methods. One is manual and another is mechanical. Manual method of resuscitation without any mechanical aids. It has two methods. Manual method A. It is two methods. First is mouth to mouth, and second is Holger-Nielsen method. Mouth to mouth method. The subject is kept in the supine position. The resuscitator kneels at the side of the subject. By keeping the thumb on the subject's mouth, the lower jaw is pulled downwards. The nostrils of the subject are closed with the thumb and index finger of the other hand. Then resuscitator, he takes a deep breath and exhales into the subject's mouth forcefully. The volume of air exhaled must be twice the normal tidal volume, means 1000 ml. Tidal volume is 500 ml. This expands the subject's lungs. Then the resuscitator moves his mouth from that of the subject. This procedure is repeated at a rate of 12 to 14 times a minute till normal respiration is restored. It is most effective manual method because the CO2 in expired air can directly stimulate the respiratory centers and facilitate the onset of respiration. Second is Holger-Nielsen method or back pressure arm lift method. The subject is placed in the prone position with head turned to one side. The hands are placed under the cheeks with flexion at elbow joint and abduction of arms at the shoulders. The resuscitator kneels beside the head of the subject by placing the palms of hand over the back of the subject. The resuscitator bends forward with straight arms and applies pressure on the back of the subject. The weight of the resuscitator and pressure on the back of the subject compresses his chest and expels air from the lungs. This procedure causes expansion of thoracic cage and flow of air into the lungs. The movements are repeated at the rate of 12 per minute till the normal respiration is restored. Then next is mechanical method. Mechanical methods become necessary when the subject needs artificial respiration for long periods. It is essential during the respiratory failure due to paralysis of respiratory muscles or any other cause. The mechanical methods are of two types, Brinker method or ventilation method. Brinker's method. In this method, subject is placed inside iron lung chamber or tank respirator with the head outside the chamber. The pressure inside the chamber is made positive and negative alternately. During the negative pressure in the chamber, the subject's thoracic cage expands and inspiration occurs, and during positive pressure, the expiration occurs. Next is ventilation method. In this method, a rubber tube is introduced into the trachea of the patient through the mouth. By using a pump, air is pumped into the lungs with pressure intermittently. When air is pumped, inflation of lungs occurs. When it is stopped, expiration occurs and the cycle is repeated. The apparatus used for ventilation is called ventilator. There are some questions. Reference books. Thank you.